Welcome to the Association of Healthcare Emergency Preparedness Professionals podcast. AHIP was formed in 2014 to move preparedness forward by advancing the profession through best practice sharing, education, and professional standards. We hope that you enjoy this program.
Welcome to the AHIP podcast. Today we are here talking with Steve Ikuda and Stephen Rosberg, who both work for Intermountain Healthcare in Utah. And they are going to talk to us about a mass casualty incident that happened that affected multiple sites, and they had unique challenges. First, I'd like to get started with Steve. You want to give me a little bit of information about your background? How'd you get into emergency management?
Thank you. Steve Ikuda, Emergency Management, South Area Manager for Intermountain Healthcare. Our organization has 24 hospitals. I oversee 4 of the 24 hospitals here in the southwest part of Utah. My home base is at a level 2 trauma center, Dixie Regional Medical Center. The other 3 hospitals I oversee are, one's a community hospital and the other 2 are critical access. And one of those critical access hospitals happens to be Garfield Memorial Hospital, where they were the receiving hospital for the incident that took place involving Chinese nationalists up at the Bryce Canyon area of Utah. I've been emergency management full-time here at Dixie Regional for the last 12 years. I'm also an instructor for some national federal agencies.
Excellent. Thank you. And as a comment, I'd like to say that I've known Steve for a few years now, and he is one of the most ambitious emergency managers that I know. I feel like you are always trying to get prepared for the next big thing, and you're always anticipating what's going to happen next. So I'm always impressed with your planning. Stephen, want to give us a little background on you?
Yeah, so I've been with Intermountain Healthcare for about a year and a half. Prior to that, I worked at the local health department here in St. George area. It was a 5-county health department. I worked in emergency management. So Steve and I actually worked closely there with the Healthcare Coalition, just a variety of different things. I was the chair of the coalition. He was the co-chair, and so there was a lot of collaboration and things that we've known each other for quite a while. And so just in the last year and a half, we've teamed up a little more directly. So I work at Dixie Regional a couple days a week, and then the other days of the week I'm up at the Garfield Memorial Hospital where this incident took place. It's a small, Dixie Regional is trauma 2. Garfield Memorial is a critical access hospital. We're very rural. It's about 120 miles north of Dixie, where we are today. So that's my background. Just been doing emergency management for about 8-9 years now.
Excellent. Well, tell us about what happened, because I think that your story is so interesting. Just hearing what all happened with this incident, I think you had some unique challenges. We'll get into the unique challenges, but if you want to just give us a quick overview of what the incident was so that we kind of know where to go from there.
All right. I was at the hospital when the call came in. I was in one of the conference rooms. We were doing basically a fire drill training, and in the middle of that, the nurse manager for the medical surgery came running in and says, "We've had a major bus crash, and we need some help." And so it was, of course, dropped everything and ran to help out with what we needed to. So what happened, it was about 11:30 morning on a Friday. This bus, my understanding is they were coming from Salt Lake down to Bryce Canyon. So they had made it all the way. It was like 2-3 miles from the Bryce Canyon National Park entrance. And somehow the bus was just kind of a gradual turn. It's kind of a picturesque area with the meadows and a lot of pine trees and stuff like that in this particular area. But the bus somehow just veered right off the road a little bit. It clipped one of the little sign markers on the side of the road, made a fairly sharp left-hand turn, and then overcorrected again to the right, and that's when the bus ended up rolling to its side, slid for 20-30 feet, and then hit some guardrails where the bus actually flipped up around and actually landed back on the chassis of the vehicle. So it was about, again, 2 miles or so from Bryce Canyon. there was people that stopped and called 911, and as that call went in, the challenge that they always have up there is there's people who drive through there, but they don't always know the mile markers or locations, and so the particular truck driver that did the 911 call was a little confusing on, well, where is this? It's actually in Bryce Canyon, which is a couple miles away, and so it's a challenge that they're somewhat used to in Garfield County. But they finally figured all that out, got all the EMS on the way, and as the EMS pulled up, they said, we have a mass casualty incident, and so all hands were on deck. As they announced that, one of the sheriff's deputies went and grabbed the MCI trailer that was just happened to be a couple miles away, staged at Bryce Canyon. Then the whole activities of responding, transporting people to the hospital, which was about 20-25 minutes away by ground transport. There's an airport that was about half-mile away. And so just where they were, there's a variety of different activities that took place to help and respond to the 30-person bus that had wrecked. 4 people were dead at the scene, and then the other 26 needed some help and support. 19 of those actually came to Garfield Memorial Hospital. Being a critical access hospital, they stabilized and would transport, so we had a variety of air assets and ground transportation to help move patients to the appropriate level of care. Hopefully that's a good summary. We've stepped into a little bit. There's definitely more details.
Yeah.
So,
Well, so I have a question for you guys. What is a mass casualty trailer? I heard you say they brought in the trailer. That sounds like that's something of your doing, Steve, one of your planning tools. I've never heard of that.
So this is an asset. The state actually has these MCI trailers staged throughout the state just for an incident like this. They relocate them to any major incident such as the Ironman triathlons or the Huntsman World Senior Games. So any big activity throughout the state emergency MS folks will notify the closest agency who has those trailers. And so, okay, we're going to have an event down at, in the Southwest area, pre-stage it. And so there happened to be one staged because where Bryce Canyon is, it's somewhat in the central part of the state. And so that's the why behind having access. And what these MCI trailers consisted of were backboards, trauma kits. They have IV solutions, bandaging, hemorrhaging, tourniquets, etc., to be able to handle an MCI incident such as this.
Wow. So so your state must manage those the supplies to ensure that outdates are within range and all of that. Is that who manages that as a state asset?
Yeah, so whoever's the owner, the stakeholder of those trailers, they do an annual inventory. And so, for example, when the IV solutions are coming close to expiration within 6 months, they'll work with their local community partners to either transition them out or get a reorder supply back to the state Bureau of EMS.
Excellent. Sounds like an asset that could be dispersed across the country that would be useful in any incident like this. So tell me more about your incident. I heard you say you had 19 patients and you had a critical access hospital. You have 15 beds, 15, 19, that doesn't add up. How did that go? How did you manage that?
Bottom line is they handled it very well. One of the things that I learned from the experience was that the staff at Garfield Memorial Hospital is well trained. They deal with this type of trauma all the time, from car accidents and different things like that happen just because of the number of people. To give you an idea, the county has about 5,500 people, but during the summer there's at least 10,000, 12,000 people that are coming in to visit the county and the national park there. And so that's partly why the MCI trailer is staged at Bryce, because that's where all the people are. And instead of Panguitch, where the hospital is, it's just a smaller community. Things worked out. There's just a whole bunch of different little things that happened that day that enabled us to respond well. The distance that the scene was from the hospital was, I mentioned about 20-25 minutes. One of the things that was helpful for that is there was kind of a natural pacing of the ambulances going back and forth. and to transport the patients to the hospital. And so that enabled the team at the hospital to, have a patient arrive. They would work with them, stabilize, move to a room, and then others would show up. Sometimes there'd be 3 or 4 people in an ambulance, all red, yellow, and green colors as they did their triage. And so just that there was a natural pacing that helped out the staff to be able to respond, so we weren't terribly overwhelmed, I should say. One other good thing that happened that day was there was 4 well-trained trauma nurses that were in Garfield Memorial for training that day. And so, of course, they canceled their training and gowned up and dove right in. But it was, so you have this extra help and support. It was also a unique day where we don't always have the providers, the doctors on site, but they happen to be all there. And so just a combination of things that enable us to have enough help and support. I think because there's about 150, 60 staff members at Garfield, and I think like 120 of them were actually either called back or helped out in response because they all live somewhat close, and so there was some good help and support to be able to take care of the patients that they needed to.
And I think I want to add on to Stephen's sharing of that incident that day is that Intermountain Healthcare has air and whether it's fixed wing or rotor medical assets. And so when it was declared as an MCI, the protocol for our life flight team, life flight dispatch, was to launch multiple aircraft, fixed wing as well as rotor. The closest rotor happened to be on deck at Garfield because they were there to pick up a DIA patient to be transferred back to our level 2 trauma center. So the rotor was already there and the life flight team was already there. And so what they did is they they actually flew the DIA back to Dixie, but then also on the way back up to Garfield, they brought back blood products, knowing that Garfield was going to start receiving multiple, trauma, either trauma 1 or trauma 2 patients that may need blood products. But in the meantime, our Salt Lake headquarters dispatched additional rotors as well as fixed wing. We have a fixed wing down here at Dixie. They flew another fixed wing up from Salt Lake, and was very fortunate that the airport that Stephen was mentioning was only a mile north of the critical access hospital, but also there was a airstrip over by Bryce Canyon where they also flew out patients from there from fixed wing. They were also able to bring in additional outside agency medical rotor helicopters as well as fixed wing as well. So it's a standard protocol within Intermountain as far as launching rotor and fixed wing aircraft to an MCI, especially in a rural area. The other nice thing, it was September 20th, it was Friday, it was a summer day, the weather was beautiful, so, responses for caregivers to come back to the hospital, there was no problem. Obviously being in a rural area, no traffic other than the cattle crossing guards, but they didn't happen to have any cattle crossing at the time. So yeah, a lot of things were going in favor of this critical access hospital and responding to the MCI.
Wow, that's amazing. So moving on to the other component of the MCI that we really haven't touched on yet, that this was a tour bus of Chinese nationals. And those of us that are in emergency management and have done exercises all along, what is the number one after action report item? It's always communication, right? So your communication, you had a problem, like you had problems right from the beginning of the incident because you needed to speak to people that you didn't speak their language. So tell me more about that. I mean, that is such a unique communication concern and not something that I think we typically plan for. We typically plan for communication with our partners. We plan for communication with our employees, how to get our staff back into the hospital quickly like you guys did and you were successful with. I'm sure that was something that you'd practiced in the past, your call-in. There's so many components of communication that you practice over and over again, but you couldn't have possibly practiced for this one. So tell us a little bit more about that.
I wanted to preface this. So I got a call from Stephen since he was up at Garfield. He pinged me to say, we've just heard that there's an MCI of a bus crash. And so one of the couple questions I asked him was, do you know if the incident commander on scene has determined whether or not hazmat materials have been involved? And secondly, are these foreign nationalists? And if so, what nationality? And then the third question was, ask the incident commander that's on scene whether or not there's any pediatric patients that are involved. So, Stephen?
Yeah, so just Bryce, you go up there and you hear all the different languages, really from around the world. It could be European, German, French, Italian, any of those, and then Asian, or the Japanese, Chinese, and so they're used to seeing that. So I guess let me start at the scene. One of the good things that did happen at the scene is that one of the EMTs who responded to that area spoke Mandarin. He deals with business quite a bit in China, travels there probably annually, and has spoken Chinese for years, and so he was there to be able to help and support at the scene. It was a little challenging for some of the EMTs. I remember talking to one of them, and they said, I tried to engage somebody, you go down your steps of the start triage, and so they were somewhat non-responsive, and so somebody got kind of graded at a red when they maybe shouldn't have been, but they didn't respond because they didn't know what he was saying. They just didn't speak the language, and so it was difficult. But it's not just that responsiveness, but there's the other vital signs that really helped them to kind of do their triage and determine who should be transported first and whatnot. Then when his things came to the hospital, that same EMT actually probably partway through, I don't know exactly when he arrived, but he ended up at the hospital to help in some of the interpretations, working with the patients, we're supporting the staff. The other thing that they have at Garfield Memorial, it's actually an Intermountain program, is they have interpretation machines. They're basically an iPad that has services that call to a contracted service who have medically qualified interpreters to be able to respond and help with communications between the staff at the hospital and the patient. We ended up feeling like we needed more of those translator devices. We had 4 of them. There was a request for some to come. They came, but he really didn't get there because it was other hospital they came from was an hour away. So you think about that timing. By the time we got there, they never really even turned them on, but we had them there in case we needed additional translation, interpretive support. And we always go back and forth between interpretation and translation because it's really interpretation is really what the key thing is. Translation is more of a written version. The interpretation is more of the verbal. And having somebody who's medically qualified is a key requirement. They are required to have that medically trained interpreters. And so that's what that service did using the iPad. So that was very, very helpful. It was a challenge all the way through. And as the incident moved from Garfield Memorial, as patients were stabilized, it all moved down to Dixie Regional, and that translation, interpretation stuff just continued for weeks, where people ended up not liking the iPad. They liked the person-to-person type stuff, so there was additional challenges that the case managers and social workers had in that situation. But the focus was always if there's medical something going on, then there needs to be a qualified medical interpreter.
So when they were arriving at Dixie Regional, one of our hospitals is actually Chinese. So she tied in with the ER staff and was the lead interpreter. When we stood up the command center, we were told that our Washington County School District has a Chinese immersion program. And so we had our liaison reach out to the Washington County School District to ask for the Chinese immersion teachers to come into the emergency room to help interpret the non-medical conversations. And so that was a plus for us to reach out to our community partners. One of the positive things when you're working with planning from community partners, whether it's school district or your long-term care, is know what their assets and resources are, and knowing that we had a Chinese immersion program, it really benefited in the long run, not initially on the response side, but also the protracted care of the patients. These folks arrived on September 20th. We didn't repatriate the last one until the second week of November back to mainland China. So they were with us for about 6 weeks.
That's a long time. And you guys really, now we know as a country, who do we call if we need Chinese translation, because you guys have figured it out. You know all the people to call, right? So your work with all of your community partners has probably done a lot of good, and we can call you when we need some help. But speaking of community partners, I know you guys have always done a lot of planning and work with your community partners and exercise. So clearly that worked out for you. You guys knew who to call. You knew who had the phone numbers that you needed right then and there to make this actual incident response a success. You did a great job. Do you want to elaborate further on your community partners planning or any other piece of this event that you feel really went well and you think others would benefit from making plans that are similar to yours?
Yeah, one of the things, and I'm going to start not necessarily with community partners, but the partnerships that Intermountain has among their hospitals. One thing that was very, very beneficial was that the systems are all built where all the hospitals can share the information. And so Dixie Regional was looking at the boards of the patients, looking at all the information that was coming in from the reports by the doctors to the imaging activities that were going on, and so they could see and do some additional prep work so that when someone was life-flighted, the road or down to Dixie, they were prepared for whatever that case was, whether they needed to get them into surgery quickly or I don't know what really happened with all that, but it was a very, very good partnership with the way that the hospitals are set up to be able to share information on patient conditions. Moving into I don't know, did you have anything else on the hospital side before I move to the community partners?
Yeah, absolutely, Stephen. That is a big advantage with a Intermountain Healthcare organization that uses the same equipment, same applications. So while Dixie was recalling staff to come back in, obviously they were delaying elective surgeries in the ORs to free up OR suites, as well as calling in our trauma surgeons, because they could actually see on the dashboard and look at the films, the imaging, the radiographs, or the CT scans, or the MRIs of what was taken at Garfield, so that our neurosurgeons and our orthopedic surgeons, anyone that was a possible case going to the OR, they already had a heads up of what type of injuries, what is it that they're going to need. And so huge advantage of being able to have that single platform sharing amongst within the healthcare organization. And not only community partners, as Stephen will elaborate, but I told Stephen this just became an international incident after I heard that it involved Chinese nationalists. Knowing that the Chinese embassy back in D.C. was going to be involved, the NTSB was going to fly out an investigation team. From the state level, you had investigators, and the MEs that would be involved. So all the way from the federal level that we've talked about, feds, state, regional, local community partners. It was the whole thing that took place on September 20th.
So related back to the community partners, because the emergency manager for the county was right on board. She works right up with dispatch in the county. And so after some time, she ended up coming down to the hospital. It was kind of a stressful time, because she was the one getting all the calls. We just kind of let the county deal with all the news media, and they got calls from everywhere. And I remember one time during the event where the emergency manager just took her phone and just kind of threw it on the table because she was like, I can't keep up, with things. And so we were there to support one another, and we had on our board the manifest from the bus, and we were trying to match people up because they were spouses, and this is the other part of the communication. Even though we knew names, but how it's spelled, it's like picking someone's name. How many different ways can you spell it? Same thing happens in Chinese, and so just trying to mix that whole mix of things. But the community partners helped out. The highway patrol, since it was on a state highway that the accident occurred, they had a team come down, and it was interesting how we were kind of working to help identify decedents, confirm decedents, and then there's the notification to family. how that's dealt with is so critical because, just how you handle that, because there's a proper way to deal with that. And the community partners all helped and teamed up together to make sure that that part was taken care of, that families, spouses were put together, even at Garfield before they were transported down to Dixie, spouses were put in the same room and make sure that they knew each other was okay. And so there's kind of that mental aspect that just kind of naturally happened with trying to help people, not just for physical injuries, but the psychological part of joining people together. And then EMS, I've already talked about how everybody's engaged, worked together. The EMS, that they were very active in the ED, in the trauma rooms, and helping each other, and almost too much, because sometimes it's like, let's clear out the ED. There's so many people in there because with all the incidents, just moves into the hospital, and so it was pretty busy a few times in that small ED. There's 3 rooms, there's 2 treatment rooms, and a large trauma room in that area. But people understood and helped out, and heads down, worked, let's get this taken care of together. And then I guess the other community part was we had, I think it was 7 people that were treated and released. So they needed to find a place to stay. They didn't have any other luggage, none of their stuff, and so people in the community helped find hotel rooms. One of the hotels actually brought their van out to transport those who needed a place and took them out to their room for the night. And so just all those different components. And then the other part we didn't know is because in our plan is to set up a family assistance center, because we didn't know if there was going to be families, there was going to be a need to have a local support from a center. So that was kind of activated, and we never ended up using it, but it was one of those components. Where do you put the media? And so all those different parts came together and worked well.
So when we received the patients down here at Dixie Regional, one of the other community partners was the American Red Cross. They came in and provided these humanitarian services for those patients that were transferred down here but then discharged. But then also they worked with the patients that still needed hospitalization. And so one of the biggest things was medications, prescription eyeglasses. And so working with identifying the ophthalmologist or optometrist to come in and get these eyeglass replacements was crucial. But then also we reached out to our local Chinese restaurants to provide type of meals that these Chinese nationalists were used to eating. And so it was neat to be able to walk in through the cafeteria back and to see one day some of the Chinese visitors as well as the patients who were there eating pizza. Otherwise, the majority of it was a lot of just Chinese-driven food that they would bring in from the Chinese restaurants. But the American Red Cross was definitely a crucial part in helping with our case management social work. Another big thing was the luggage. Where do you store all that luggage that was recovered from the scene? And so we used the local hospital church to be able to store all that luggage. And, obviously you had the tour bus company who had there with their council. You had the Chinese embassy folks come out. You had the NTSB. One thing is if the NTSB is part of the investigation, they will come in to your hospital, and this is a key takeaway. The NTSB is a federal agency that is approved to provide HIPAA information. That's very crucial. That's one thing that the NTSB was so happy to know, that when they came in and into an Intermountain hospital that had these Chinese nationalists, that they knew that they didn't have to go and get a subpoena. And so that was less red tape that they had to go through. But they also had a meeting with not only with the Chinese patients that were there to answer questions about, what role does the NTSB have, but we also had our hospital staff. And originally it was slated for 2 hours. Well, it ended up being a 4-hour session because we actually had a Chinese interpreter on the phone, had to interpret what the NTSB was saying to the Chinese nationalists, and then we had to wait for the Chinese nationalists to ask the questions or respond, and it had to go through the Chinese interpreter, and then he had to interpret that back into English. So it was a long 4 hours, but we're able to communicate back and forth. So whenever you're dealing with foreign nationalists, it is time consuming.
Sounds like you had a lot of experience that you didn't expect. So can you tell me what were the top 3 takeaways that you would like to share with others? Because I think we're coming to an end of our time. What are the top 3 things that you think other facilities could do to plan for an incident like this?
Well, I think for staff, they just need to trust in their training. They've been trained to deal with situations. It just happens to be a whole bunch of it all at once. But as they trust in what they know how to do, then I just let them be there. And I think my part was stay out of their way, let them do their job because they know what to do, and then just be there to support the emergency manager or the liaison at the hospital. What can we do to help support the activities that you need to do as the staff responding to direct patient care? I think that was a key one. Other one is it's important to have your key relationships with partners established. It just flows so much better when you know somebody. You've met, you've been in trainings together, you've talked through a variety of issues. When you end up teaming up in a stressful situation, it works well. And I think the other is to continue to work on communications during regular drills and exercises, because even though you'll always have some communication challenges, you've at least worked through some of the basics to make sure you're communicating well as a community. This one threw a whole twist with the language barrier, but overall, communications is always one of those hurdles in any response. But when you practice and do drills and exercises, you're a lot further along down the road. Even though you'll probably still have the challenges, you're still able to do what you need to do and eventually help and respond to the incident.
And I think what Stephen said, communication, is when hospitals are conducting exercises with their community partners, always throw in those populations that will challenge the participants, the players, such as throw in a deaf patient that actually is deaf. Throw in a patient that only speaks Spanish, German, Italian, Chinese, because that's what's going to happen. I think what could have been an incident within an incident is that this Chinese tour bus collided head-on with another foreign national bus. Now, instead of just having one set of interpreters for Chinese, now you have to go and get German or Italian or Spanish. And one big takeaway is the case management and social workers, they were knee-deep, especially in getting these Chinese nationalists back to China, is daily briefings between the Red Cross, the hospital, the Chinese embassy. Like I said, this went on for 6 weeks. So on the back end of the recoveries, in order to get the patient out, you definitely need your case managers, your social workers to make that happen. That is an internal department is crucial in any type of influx or surge, just like we're dealing with COVID patients that are now coming in from memory care or long-term care facilities.
Yeah. Well, all of those challenges, it sounds like you guys met the need and you had a successful response, and we really appreciate you sharing your story with us today, because that's what these podcasts are all about. We are hoping to hear stories and hear lessons learned that we can emulate across the country, and hopefully we'll all be better prepared the more that we do these podcasts. So thank you both for spending some time with me today, and hopefully you have a very relaxing rest of your summer. No more
incidents. Thanks, Christy.
Yeah, awesome. Thank you.
Thank you for listening to AHEP's podcast. We hope that you will come back and listen to other educational programs in the future. For more information, please visit our website at www.ahepp.org.